What's up, everybody? I hope you're doing well. Today, I thought we would tackle the question of whether therapists are allowed to have our own problems. Okay, obviously we're allowed to have our own problems, but like, what problems are acceptable? I think that's a question that comes up a lot, and I want to tackle it. Unfortunately, in so many contexts, we continue to receive this messaging that certain kinds of problems are not acceptable for therapists to have. So what to do for the therapist who maybe has one of those quote unquote problems and then is trying to get support for it, but feels like they're not allowed to talk to their consult group, their supervisor, or maybe even their personal therapist about it because maybe those problems are problems they think they're not supposed to have. So then you have this recipe for secrecy and shame because now you're not allowed to have the problem that you have and you're not allowed to get help for the problem that you have. So none of this is working. So yeah, I think I just spoiled the whole episode explaining why it's happening and what my opinions are, but I think there's a lot more that we can get into here. I was curious to ask you all to share some of your input on what some of these problems that therapists aren't, quote, supposed to have are, just based on your experiences and perceptions. So I put this poll out on Instagram that says, quote, what problems/struggles are therapists not, quote, supposed to have? And y'all came through. I didn't count how many responses there are, but definitely a healthy amount of responses. And we saw some themes come up. So I thought it might be helpful to name what some of those themes are and then maybe follow up, like, do therapists struggle with these problems that, based on your responses, people think we're not supposed to have? So the top response or category of response by far was relational and family issues. There were 12 total responses in this category, and I'll rattle off a few of these to kind of paint the picture of how people responded. And remember, people are answering the question, what problems or struggles are therapists not, quote, supposed to have? Someone says, problems in your marriage, relationship difficulties, trouble expressing wants and needs, marital or other relational problems, relationship problems, go through a divorce, relationship issues/poor communication, family conflict. Definitely we're hearing a theme come up, like relational, family conflict, divorce getting mentioned directly as well. At face value, we might say, like, therapists shouldn't have significant relationship or family issues, because isn't one of the primary things that we help people do is to navigate relationship and family issues? And so if we can't get our stuff together in our relationship and our family, assuming we even have a relationship or a family to begin with, by the way, which is also its own sub issue, but we're not even going to tackle that in this episode. Like, if we can't, quote unquote, solve whatever our relationship family issues are, how are we then supposed to help other people do the same? But this raises the question, like, do therapists have relationship problems? And this is one of those things that we only have so many ways of like attempting to measure. One thing that can be measured is divorce rates, which, you know, a couple can very much be married and have relationship issues, but it tells us something. So the question is, how many therapists get divorced and how does that compare to the general population? I'll reference this data from a place called Flowing Data that mapped out the percentage of divorce based on different occupations. Here's counselors. The median divorce rate, just based on the image, it doesn't give the exact percent, but just eyeballing it looks like it's falling at around 36%. And if you look at this general chart, it's right pretty much in the middle, definitely right along that median line. So at least based on this census data of divorce and occupation, counselors are right in the middle of the road. Fancy that. Therapists are humans too, with relationship problems too. And the next most common response in this poll that I put out lined up with kind of what my hunch was that people would say, and that's things in the category of personal mental health or addiction-related concerns. Some examples of folks' responses in this category included depression, anxiety, or eating disorders. Someone else says having mental health challenges or needing support on a bad day. Another says some believe we are immune to mental health diagnoses. Helpers are supposed to have these. That's an interesting comment. Somebody says helpers are supposed to have these. The list goes on. Addiction issues, anxiety, depression, addiction, eating disorders. Not allowed to have depression, anxiety, or marital or relationship problems. So somebody lumped them together. I think the idea of having been through a mental health concern or an addiction issue and then coming out the other side and becoming a therapist is like a trope. I think that is generally glorified in our profession. But the idea that like today, right now, I am struggling with some kind of mental health concern that's significantly impacting my life and I'm helping other people through their mental health concerns, I think there are a lot of circles where that is frowned upon. And again, I get it at face value, but it's just unrealistic. Like therapists are humans who go through their own hard things, and we're still showing up for our jobs as we help others. Of course, as with anything, if there's something that's affecting our ability to do our jobs well, we are obligated ethically to make sure we're getting the support we need so that we can make adjustments and make sure that our clients are cared for while we're hopefully also taking care of ourselves. But that doesn't preclude us from having mental health concerns or even severe mental health concerns. So all of this raises the question, what is the rate of, like, let's say mental health concerns, mental health diagnoses amongst therapists? I looked into this and it's not the easiest question to answer, but I did find this helpful article that I think is actually like a podcast interview from the Association for Psychological Science titled "A Paradox in the Field: Mental Health Disorders Amongst Psychologists." As is always true, anything that I mention in an episode, I link to, so you can find this linked in the description if you wish. Sarah Victor is being interviewed about some of their research about rates of mental health concerns and diagnoses amongst therapists. And here is a quote from this article. Sarah Victor says, quote, "We ask people very broadly, have you ever had a mental health difficulty? Yes or no? And we didn't define that for people. We let people define that for themselves." And then later they go on to say, "We also asked, have you ever been diagnosed with a mental health condition by a professional? Yes or no?" And we found that over 80% of respondents said yes to that broad mental health difficulties questions, and a little under half said yes to the diagnosis by a professional. And then the interviewer asks about how that compares with the general population. And Sarah Victor says, quote, "Overall, rates are pretty similar to what we find from large epidemiological studies that assess lifetime prevalence of any mental health condition." They go on to say, "The area where we see some differences is that we would often sort of define or refer to as quote unquote severe mental illness. So things like psychotic disorders, personality disorders, we tended to see a little bit lower prevalence than you find in population studies." Okay, the rest of the themes that popped up in this poll had much fewer responses than those first two primary themes, but I think they're still worth noting. The next most common theme, with 4 items kind of connecting to this theme, was emotion dysregulation. Here's some of the responses people sent. Trouble regulating emotions or anxiety. Emotional dysregulation. Somebody phrased it with a question mark. Emotional regulation? Question. And the last one, intrusive thoughts or struggles with parenting. And then they put in parentheses, child therapist. I don't know if this is a research phenomenon of like, can therapists keep their cool better in their personal life than the average person in the population? That'd be probably a little bit harder to study, I imagine. I think about this all the time. Like the people that I get most annoyed with are not my therapy clients. It's the people that I share a living space with. And it's not because they are more annoying, though. Let me tell you, the things that a 3-year-old and a 5-year-old can get away with are just... But nonetheless, it's not just that. It's because you are like stuck with the people that you're with, you know, versus like you come in for 50 minutes, bye-bye, I'll see you next week. I'm guessing if there were a way to research this, probably the level of emotion dysregulation that therapists experience, I should say, in their personal lives, hopefully not professionally with their clients, but in their personal lives probably reflects the general population because we're human. We're human. Okay, another one that came up a lot is that therapists were saying we're not, quote unquote, supposed to experience lack of empathy for our clients. Someone says lack of empathy toward clients, aka burnout. Someone else says not liking their client. And a third one says struggle taking on their client's mental load. The idea that we're supposed to like every single client is kind of ludicrous, especially if we imagine that for at least some of our clients, if not most of them, they're having some problems that likely impact their relationships. And it would be very, very normal and expected that if they're bringing that into the session, they might be bringing some of those characteristics in their relationship with us. It's kind of a good thing to me, I think, when it comes up, because then that means hopefully they're not masking whatever their problems are. You're seeing it for what it is, and hopefully you can help them. And to be clear, I like almost all of my clients, but we all have had at least some clients that we don't like. And that's just normal human experience. Doesn't mean that we can't help them. Another category that came up was money concerns that therapists aren't supposed to have, which stands out. Some responses in this category just says, money issues, just work for pennies and help your clients and be thankful for what you get, LOL. Yeah, I can't believe that one's still going around. But that one's solidly still going around. It's tough. And another response in this category, dissatisfaction with low pay reimbursement from insurance. Like kind of same thing, like you work so hard, you've probably accrued a ton of student debt. You've delayed your income a ton because it takes forever to get licensed in our profession. And then you come out and you get paid comparable levels to somebody who has a college degree and sometimes even professions that only require a high school diploma. So yeah, it makes sense that we'd have money concerns about that. This isn't across the board, but definitely on average can be true. So there were a couple of responses that I thought was kind of interesting. I titled these as having a human range of emotions, that maybe somehow we're not supposed to have that. The responses were fear of rejection. That sounds like a human experience. And another response says with grief and loss. If any profession is the profession that should experience emotions and potentially intensely, would it not be our profession? But yes, I think some people do kind of expect us to be a bit robotic and not feel feelings. And another category that came up, I just called being affected by our client work. I guess this does kind of overlap with the lack of empathy for clients. But some responses in this one say struggling to let go of distress after a session. And another one says, we aren't supposed to be impacted by the work we do, i.e. secondary trauma, or minimally, we are not to be impacted by the work we do. Yeah, of course we're impacted by the work we do. Like, the dichotomy there of like the most valuable predictor of how effective and successful therapy treatment is how genuine the client believes the therapeutic relationship is. Basically, if a client believes that their therapist really cares about them, that's going to have a huge positive impact on the outcomes they experience. And yet, we're also expected to not be affected by the work. So how are we supposed to genuinely care for somebody if we're also then supposed to not be affected by whatever is coming up? Like you can't have one and not the other, you know? Okay, there was one last category of response that is quite weighty. And I actually recorded most of the section and then my camera randomly shut off. I don't even know if I believe in signs, but I'm going to take it as a sign to just leave that super weighty topic out of this episode. I was already kind of on the fence about it. So I don't know, I'll consider like maybe linking in the description box if you want to see those last couple of responses. Well, I think that's a good place to leave off on. And thank you, as always, to those who sent in your responses. I'm always amazed how many people respond and thoughtfully. It makes episodes like this so much more valuable. The lines feel a little more colored in to me when I have poll data like this. So I really appreciate you participating in the poll to make this episode possible. Well, I titled this episode that, therapists are allowed to have problems, right? And it's a little bit tongue-in-cheek because of course therapists are allowed to have problems, but I just wanted to put this out there to say like, whatever kind of problem you have or you're afraid might develop or something, like it's so much better to make sure you find safe support to navigate that problem rather than to have the narrative, whether you created it or someone gave it to you, unfortunately, that like somehow you're not supposed to have that problem. So therefore it needs to stay a secret. Like that is a recipe for spiraling. So I don't want anyone to spiral from the belief that we're not supposed to have problems or certain kinds of problems. I'd much rather you go get support. I hope you found this helpful and supportive in some way. And before we close, I'd like to thank TherapyNotes.com for sponsoring this episode. TherapyNotes helps with all of your practice management needs, from scheduling to notes to billing. They have a HIPAA-secure telehealth platform and so much more. If you'd like to check out TherapyNotes, you can get 2 months to try it for free with no commitment just by clicking the link in the description of this video. Thank you for hanging with me, and feel free to leave in the comments if there's other topics like this that you feel like aren't getting as much attention in our field as they should, as far as it could be about anything, honestly. But I'm thinking in particular in the realm of like expectations people have about therapists or, things that we're not supposed to experience or go through. I feel like we should just talk. Let's just talk about it. Let's just air it out. It's fine. Whatever it is, we're going to be okay. We're going to be okay. Let's have some like secure attachment to ourselves and our profession, like, or at least move towards it. So I'd like to participate in that anywhere it's possible. And until next time, from one therapist to another, I wish you well.